This is Ashley Klein from Prevent Connect. I want to welcome you to our web conference today, Shared Risk and Protective Factors to Prevent Sexual and Domestic Violence, from Research to Policy and Practice. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. Our objectives today, we're going to be, again, I mentioned, looking at this Connecting the Dots document and how it's been put to use to prevent sexual and domestic violence and other forms of violence. We'll be exploring examples of multi-sector and multi-issue efforts to address prevention, and then really through shared risk and protective factors, and then exploring the strategic vision for connecting the dots and how that can guide local, state, and national violence prevention practice. So with that, I'm really excited to introduce you to our two co-hosts for today. I want to welcome Lisa Fujie-Parks and Mego Lien, both from Prevention Institute. Lisa and Mego, how are you today?
I'm doing great. This is Lisa. Thanks, Ashley.
Hi, everyone. This is Mego. I'm doing well, too.
Wonderful. Well, I'm going to go ahead and pass it over to you, Lisa.
Great. Thank you so much, Ashley. Really appreciate that introduction and getting us all started. And hello, Prevent Connect community. It's a real pleasure to be here today. We are excited for today's conversation. And this is a real team effort. Mego and I will be helping to host, and Casey Castaldi is the biggest web influence here, really putting together the slides and the content and teching behind the scenes. So thank you, Casey. And we are going to have some really exciting guests, and I think this is a really important topic. So as you know, it's been 2 years since the CDC released the Connecting the Dots document. A lot has happened in those 2 years, and I think this issue of addressing multiple forms of violence is really near and dear to many of our hearts. So we're continuing to get a pulse on who's doing what and what you all are bringing to the conversation. So we have another polling question, and we would like you to let us know if you are currently engaged in prevention work that explicitly addresses multiple forms of violence. So please go ahead and answer the poll that you should see on the bottom left-hand side. Great. Well, the results are coming in, and it is looking like the vast majority, about over 80% of folks, are engaged in work that's explicitly addressing multiple forms of violence. So we really do hope that you will participate via text chat and share your work and your learnings and your questions with this community. We also know that folks are linking their violence prevention work to other issues. So the question now is, are you currently engaged in sexual and domestic violence prevention work that explicitly addresses another health issue? So assuming that many of the folks here on this web conference are engaged in some level of sexual and domestic violence prevention work, let us know if you are engaged in work that explicitly addresses sexual and domestic violence to another health issue like substance abuse prevention, reproductive justice, reproductive health, etc. And it looks like over half of the participants are linking sexual and domestic violence prevention to another health issue. So I think that's also a really important perspective to bring. And again, we hope that you will share and participate and help us learn together. We have another text chat question, really trying to get a sense of where folks are coming from today. So we would also like to know from you, how have you used the Connecting the Dots document, the overview of the links among multiple forms of violence since it was released? So please go ahead and share your response to that question. How have you used the Connecting the Dots document? And for those of you who aren't familiar with the document or haven't used the document, please be thinking about ways that you might use the document moving forward. And we're going to do a quick overview now of some of the content of that document while you all are sharing your thoughts via text chat. So Connecting the Dots was a document that released by Centers for Disease Control and Prevention and Prevention Institute. It's a joint publication. And what we did in that document is to find and share the research and the evidence that supports the linkages that in many ways people in real life and practitioners engaged in prevention work knew all along, and we're seeing and we're communicating for many years that different forms of violence are very interrelated, and the siloing we do of this issue versus that issue is in many ways just not reflective of people's lives and of solutions. So over the past few years since the document was released, we've also been able to learn a lot more about the linkages. We've also heard from practitioners about how this document has impacted their work. And I think it's been overall pretty positive response. I do want to share that this document was a really seminal document, and in many ways it doesn't reflect all of what we know about the connections between different forms of violence. It doesn't include all forms of violence, and also it doesn't include different forms of evidence. But it was a good, succinct summary, particularly of the research and looking at the research through a fairly rigorous lens. So we know that exposure to one form of violence increases the risk of future exposure to other forms of violence. And by exploring shared risk and protective factors, we can see here, I'm sorry, this is a slide that's showing the relationships between different forms of violence over the lifespan. So now I want to talk about actually, I'm going to keep it on this slide, the different forms of violence slide. So, we can see from this slide that factors like social isolation, weak social networks, low access to parks and open space are all common risk factors for different forms of violence. And we might be having a slight confusion with the slide and the content, but I'm going to keep going. Connecting the Dots was a seminal document that helped to make the case that different forms of violence are linked together, experienced together, share common underlying factors, and result in joint outcomes, and that exposure to one form of violence increases the risk of further victimization. So here are some images of some of the information that's conveyed in the document, showing the societal and neighborhood risk factors for different forms of violence, as well as the neighborhood and relationship protective factors. So we really encourage you, if you haven't looked at that document, to do so. And again, we look forward to hearing from folks of how this information has been useful. So we just wanted to bring this to reality a little bit, and we see examples of these connections every day in our lives and in the news. Here's a slide that shows just a few examples of recent instances of gun violence where we see that the person who committed violence out in the community also had a history of intimate partner violence. And in the bottom corner, it may be a little bit difficult to see, but that there's some statistics that really show that 70% of mass shootings actually happen at home, and 57% involve former intimate partners and family members. In another example, the CDC just released a report that was covered by the New York Times a couple of days ago, or on August 11th, so about a week ago. And it shared some new data that the CDC has made available that also really shows the interconnectedness between experiences of forms of violence. This study was about health and safety outcomes for high school age lesbian, gay, and bisexual youth. And the survey found that about 8% of the high school population described themselves as gay, lesbian, or bisexual, and that these young people were at a much elevated risk for forms of violence like rape. They skipped school far more often because they didn't feel safe. At least a third had been bullied, twice as likely to have been threatened or injured on school property. So I think this example really shows that it really demonstrates the interconnectedness of health and safety issues, and that the linkages between multiple forms of violence are felt and experienced within communities, populations, and age groups, in ways that intersect and compound and, contribute to greater inequities. And so these are, again, just not covering all forms of violence or all the ways that these interconnections are played out in communities, but we wanted to highlight a couple examples from some recent conversations. So with that brief background, I would like to introduce our first guest, Dr. Elizabeth Abla, who's going to talk with us about work that she's been involved with in her communities using the Connecting the Dots document in Kansas. So thank you so much for joining us, Elizabeth.
Absolutely. It's my pleasure. Thank you for having me.
Yes. So Dr. Abla received her Bachelor of Arts from St. Olaf College and a Master's of Public Health from the University of Kansas School of Medicine in Wichita, and a Master's and Doctorate in Community Psychology from Wichita State University. And Dr. Abla is an Associate Professor at the University of Kansas, and her research includes community-based participatory research, physical activity and healthy foods, the built environment, health impact assessments, and worksite wellness, and with a particular focus on how policies, systems, and environments can foster cultures of health. So thank you so much for joining us today. If you could get us started by telling us a little bit about why you decided to focus some of your work on looking at shared risk and protective factors, that would be fantastic.
Absolutely, and thank you very much, Lisa. I appreciate the introduction and very pleased to be on the call and the webinar with everyone today. I'm going to start out with a somewhat tongue-in-cheek example. As you all are aware, when we identify a problem, we tend to think about very tangible solutions. And that often leads us to considering very programmatic interventions, educating various groups and schools and after-school programs and whatnot, offering prevention programs. And this is wonderful. They are not inherently bad or wrong. It's great. However, it's very unlikely that on their own any sort of programmatic intervention is going to make substantive changes. And that is really difficult for a lot of us to wrap our brains around and to, I guess, implement in our ways of thinking. Public health has demanded that, especially recently in the last 5-10 years, that we have more comprehensive strategies so that we can address root causes of problems. So I'm indicating that they have boxes over their heads, not because these people are silly or stupid, but it is so much more comfortable to stay where we are. We know what we're doing, but I encourage this group, and among others, to take a step out of your comfort zone and try something a little bit different. Those of you who are familiar with connecting the dots, I think this is going to make a lot of sense to you as well. So our assessment, we were very interested in exploring what were community factors that might contribute to sexual violence and the root causes of sexual violence. And this kind of an approach screams for an assessment of community risk and protective factors, because we really wanted to look at the root causes. So there was an opportunity that presented itself for a risk and protective factor assessment of a small rural community in Kansas. So our team was thrilled to be able to have the opportunity to conduct the assessment.
Thank you so much for that background. So I'm curious, once you decided to focus in this way, what did the process look like, and how did you engage with partners and communities and get their buy-in to this approach?
Yeah, so it's a great question. I'll start with our team and describing our team. So starting at the Kansas Department of Health and Environment, this is Lori Hart. She's a licensed master social worker, and she's a sexual violence prevention and education coordinator at KDHE, the Kansas Department of Health and Environment. In 2014, she, in Kansas Sexual Violence Prevention Program, released a new application for local communities. And in that application, those who applied were asked to focus more of their efforts on community change strategies and impacting the community or societal levels of the social ecologic model. So one community, it was a rural community that was awarded funding, asked for some technical support in implementing a community needs assessment. They already had an active community coalition, and they focused on sexual violence prevention efforts. So we enlisted them to help in implementing a community needs assessment that used a shared risk and protective factor approach. And that focused on community level risk and protective factors. So community level risk, shared risk and protective factors. So then Lori and I have a relationship. We've worked together for many years. And so Lori asked me if I had a student who could help with the community in implementing this needs assessment. This is one of my Master Public Health students. And so I connected her with Cora, the student, and ta-da, we had our team. So we were able to get this team together and start thinking a little bit more about how we would implement this process. You'll see here that we had a very interesting type of experience. This is a true picture of our community. Some of these folks are coalition members, but some of them are just members of this small rural Kansas community. I'm not going to say that the words that were coming out of his mouth with the megaphone were necessarily, yes, a shared risk and protective factor approach, yes, community level strategies, but it might have been something similar. But the key here is that this was not a process of academics or even the state health department coming into the community and telling them how to do this. Now, some of you are thinking, all right, great, let the community run it. Well, yes and no. It was not even a process of the locals telling the state how it was going to be done. Really, there was much more of a give and take. The community, for instance, knew a lot more about the community needs better and understood how the topics would be received. That some would not, and so we had those conversations. The state health department, for instance, shared the importance and the relevance of assessing shared risk and protective factors and conducting an assessment of the community itself rather than the individuals within the community. None of this was easy, but all of it was respectful, and at the end of the day, all parties were interested in preventing sexual violence. And that was really the key, because if we are all open to trying new ways to accomplish our shared goal, then we really have some opportunities to make measurable and useful change.
Got it. Well, that is a very interesting and wonderful story about the beginning of your work and how it took shape in partnership. So with such a unique community and partnerships and so many different actors involved, I wonder if you could just share a little bit more about some of the issues that came up and how you addressed them as you moved forward with this community assessment process.
Absolutely. So I'm obnoxious, I know, but I love this slide. I don't think this is exactly what happened in the end. I don't think everybody was jumping up and together and thrilled that we're changing policies and saying, oh my gosh, let's do something around shared risk and protective factors. really, we had, at the end of the day, all partners considering higher levels of change, like policy change and environmental prompts that we know impact behavior. And that's a huge win for the team and for the project and the community itself. So our team met with the coalition to discuss this approach and answer any questions that they may have. So it was not an easy process, absolutely, but there are barriers because this is not the status quo. This isn't how we tend to do community assessments, but this was a really nice way for a template to be provided and folks to be able to respond and adapt to change.
Great. So we're going to hear more about the assessment process that you engaged in and where that took you. So I have lots of questions that I would like to ask, but before I do, I want to just take a look a little bit at what's been happening in the text chat so far, and also pose an additional text chat question. So far, folks have been talking about ways that they've been using the Connecting the Dots document. A lot of folks are talking about using the document in having conversations and in being able to explain the connections in a concise way. A lot of people are incorporating the information into educational presentations, community education, professional training to different folks in different fields, helping to build new partnerships and coalitions. And a couple of people also did talk about using the document in their needs and resource assessment work and in developing joint strategies and interventions. So I think especially for those folks who have used the document in that way, this next chat is particularly relevant. But we would like to hear from you what kind of assessment activities you might have completed or been engaged in aimed at addressing shared risk and protective factors within your community. So this might be an explicit effort where you integrated an understanding of shared risk and protective factors into a community assessment, or it could be something where that emerged out of something more open-ended, like a general focus group or a community forum or that kind of thing. So we're really curious about the kind of assessment activities where this frame or this theme of shared risk and protective factors has been relevant. So please go ahead and share that. And while folks are doing that, let's continue hearing from you, Elizabeth. So please, if you could describe your methods for assessment and some of the results that came out of that, that would be great.
Yeah, sure. Absolutely. So we'll see here. There we go. So this is probably familiar to many of you. This is one of the sheets of Connecting the Dots. I love this matrix. It has been exceptionally useful for us. So just to highlight the green arrow here, the shared risk and protective factors across multiple forms of violence, and in the green box is the risk factors. So we use this as, I truly believe this is a very rare and also valuable resource because first of all, it maps the shared risk and protective factors for multiple forms of violence. But let's zoom in on some of the risk factors specifically for sexual violence. And so what we did, if you see here on the left, community. There were relationship, community, and societal. We focused on community factors that are community risk factors. And you'll see here neighborhood poverty and community violence and diminished economic opportunities. Those are all in green, as is the high alcohol outlet density. So even though that was not marked as having a citation after the Connecting the Dots document was released, shortly thereafter there was a resource that became available that we are now aware that there is a link with sexual violence and high alcohol outlet density. So you can see over here on the right, I am very excited apparently about high alcohol outlet density, including it twice. It's very important that we keep it in there. And then for our protective factors, we wanted to be able to look at sexual violence protective factors. And you can see here there's only one, community support and connectedness. So when we're looking at all of these studies that that the document, Connecting the Dots, has cited as previous studies that point to evidence, this really allows us to be able to zoom in on very specific factors. So then it was a matter of how do we collect the data. And so with that, we had two methods. One, to be able to better understand these risk and protective factors. One was survey data, and you'll see here denoted that with a red check. I will return with that red check. And then publicly accessible data. So this doesn't have to be a time-intensive or even a cost-intensive process in order to proceed with an assessment like this. So for instance, risk factors that we identified, the 5 that are here and the 1 protective factor. So you'll see here, if I can get my little, there we go, we have our red arrow. So those are survey data that we collected, but we also collected all of these through public data as well. So I will note here that we tested poor neighborhood support and cohesion, even though it is not formally connected to sexual violence in the research. But we wanted to do that because we do believe that there are likely some relationships, and we wanted to test that out a little bit. So I'll go here. The next slide is community violence, and you can see this is the one that we will give as an example. So I'm going to provide an example here through the risk factor of community violence, so you can kind of get an idea of the type of data that we uncovered. So the construct here that we were measuring is community violence. We know that construct is very much related in the academic literature to sexual violence. We know that exposure to community violence is positively associated with reported sexual violence perpetration, and that exposure to community violence is associated with greater use of negative coping skills like violence toward others. So this makes sense. So that's just a point of fact of what we know from the academic literature. Now, so if we tie that on top of, or lay that on top of the issue of our data, what we identified through publicly available data, that data suggested that crime rates were rising from 2013 to 2014, which was our most available data that we had. We did not have 2015 or 16 data available to us. So the variables that are marked in bold here indicate that there were increases from 2013 to 2014. This next is what you see in front of you is data from the survey. So we measured community violence through an exposure to violence survey, and our survey data suggested that residents had the most exposure to violence via witnessing drug selling and also having seen someone arrested. And the drug selling in particular really aligned with the survey data regarding why residents didn't use some of the parks, and residents reported seeing drug deals in some of the parks. So this is helping because now we have 2 different sources of data that help to inform one another. To give you another example, on the protective factor side, we'll go explore briefly the community supporting connectedness. What does the literature say around this? We know that academic literature says that this is a protective factor. That against sexual violence, specifically rape. As a side note, some of the slides that I'm going to share with you, and that I am sharing with you, we're using our presentation to the community. So we have presented our data to the community, to the coalition, and we did not just include the data. We really wanted to hear the community's perspective of how to interpret the data and then how to obviously connect that back to the academic literature. So you'll see here one of our findings with, I should have one more little, there's my little green arrow. So the instrument we used in our assessment to assess community connectedness and support was the sense of belonging scale through the Chicago Youth Development Study. And you'll see obviously here, the lowest item on the community connectedness scale was visiting neighbors in their homes. However, as you can see on the far left, there were some areas that were really quite positive, like asking people to watch their home and knowing the names of people on their block. So there were some really good, nice protective factors within this population. So we wanted to narrow it down a little bit. So great that we know this about this rural community, but is there a way that we could focus this a little bit more? And you can see that we divided the city into sections, this community into sections, so into quadrants. We did this so we could see if there was a part of the city, for instance, that was more or less connected. And that would help us, obviously, in terms of implementing a strategy or intervention. So the higher the score on this scale of the sense of belonging scale, the higher the sense of belonging, as reported by the respondents. So respondents living just outside of the city reported the highest sense of belonging, which was very interesting for us. Among those participants residing in the community zones 1 and 2 reported the lowest sense of belonging. So we obviously asked the coalition their thoughts about this, and they told us they thought that people were more connected just outside of the city. And for one, they've been in their homes longer, and so they've known one another longer. But two, they might be more connected because of farming, and they've been helping each other out with farming. So that was really useful for us to see why just outside of the city potentially had a greater sense of belonging scale. So that was really useful for us. And then finally, to wrap that up in terms of our community connectiveness on the protective factor with publicly available data, so we wanted to look at voter participation. That was something that the literature has tied in as a protective factor of community connectedness. So this was a good resource and opportunity for us to be able to look at the voting rate in the county versus the rest of the state, and the county versus the United States. So it gave us a little bit of a point of reference, and I know I've just given you a lot of information, but I wanted to make sure that you had a good understanding of all the different type of data that we were collecting and what we did with it.
Great, thank you. Really interesting stuff to see how you operationalized your questions into actual surveys and different sources of data. But let's circle back to the text chat to hear from Ashley and Mego to see what folks have been chatting about and asking about. So Ashley and Mego, what's been coming up in the text chat?
Sure. Well, this is Ashley, and what I've been seeing is folks using, in terms of assessment activities, using data from ACEs studies, looking at GIS mapping to find areas with overlapping risks to focus on, incorporating risk and protective factor questions into youth assessments. Mego, have you seen other things?
Yeah, a number of different studies and surveys have been mentioned, along with the youth assessment survey that you mentioned. Some people mentioned community assessment surveys, campus climate surveys, as well as comprehensive evaluations of primary prevention programs with all first-year students on college campuses. And there was a comment from Tucson, Arizona, where this work informed conversations at Youth Violence Prevention Coalition meetings and help them identify priority areas for work. Also, linking to the GIS mapping comment, somebody shared a link to a map gallery from Baltimore that might be helpful to check out. And then a number of questions have come up. A number of questions have come up about getting a copy of the survey that was used, along with what kinds of specific questions were used in the assessment that addressed shared factors. So I don't know, Elizabeth, if you'd want to address that now.
Yeah, absolutely. I'm happy to share. This is the intent, right? So yeah, we want to definitely share the love, what we've learned, and so people can build on that.
Great, thank you so much, Elizabeth. Now, one thing that's striking me that I wanted to ask you is this. I mean, obviously there's a lot of great assessment work happening, a lot of different sources of data, from conversations to other kinds of data collection methods. But one thing that's striking me is this whole notion of the geography of this and the fact that you divided your city into quadrants, and other folks are talking about using GIS mapping to specific neighborhoods, or perhaps having this kind of assessment conversation in a particular school environment. So ways of really defining the community that we're assessing. So I wondered if you could speak to that a little bit, and do you think that it's particularly important to define the geography, or is this just because you were interested in doing a specific place-based effort?
Yeah, absolutely. That's an excellent question. We did have a very specific area that we wanted to assess, so we started with that for our parameters. However, I would suggest if there is a larger community than a small rural community that we used, that still there be additional markers or parameters that could be applied. So for instance, the way that we use our quadrants, that was really helpful for us to not only identify where our strengths and where people have some protective factors already built into their smaller community, but also to be able to identify potential targeted zones for strategies of how they're going to implement various interventions.
Great. Okay, well let's continue on then to hear more about the work and what you learned and what you've done with it.
Sure. Okay. So speaking of GIS, we do think that this is a potential strategy because we are at a place where we'd like to be able to assist the community coalition in addressing community violence, for instance, as a risk factor. So some strategies that we are looking at was, first of all, let's map it out. Let's understand the problem a little bit better. And so hotspot mapping of high crime areas is definitely something we are hoping to be able to begin. Second, we'd like to implement CPTED. I don't know if folks are familiar with this, but CPTED stands for Crime Prevention Through Environmental Design. It is a very well-established approach. It's a multidisciplinary approach to deterring criminal behavior through environmental design. And specifically, CPTED defines themselves as CPTED strategies rely upon the ability to influence offender decisions that precede criminal acts by affecting the built social and administrative environment. So this is a really great model that we would like to continue to build upon and implement in the community. A potential strategy around community connectedness and enhancing that as a protective factor in the community is to be able to improve the collective efficacy among the neighbors and the community in the zones and the larger community as well, since we know this is a primary means by which violence can be prevented. So why not continue to build on something that they already have going on? So those are some of our upcoming strategies of how we're thinking we might be approaching the next steps.
So thank you so much for sharing that. And it's really great to see how your risk and protective factor analysis is really shaping your work. And I was wondering if you could just talk a little bit more about the next steps in your work in Kansas and how this focus on shared risk and protective factors has changed the way that the community is approaching sexual and domestic violence prevention and prevention of other forms of violence.
Yeah, absolutely. Thank you. So the first step that we've already taken was sharing the results with the coalition, as I mentioned. The coalition was already starting to get excited about potential strategies that they could implement. An action planning session with the coalition would be the next step. The coalition already includes representatives from Parks and Rec and Sheriff's Department, among others. And expanding the coalition to include these different sectors of the community really has enhanced the process for this community, and I think can continue to enhance the process. We definitely hope to replicate this shared risk and protective factor assessment approach in other communities across Kansas, and I'm thrilled to hear that others on the webinar are interested as well. We're very dedicated to the process. And because many of these risk and protective factors are shared, obviously more of our partners are meaningfully engaged, and so we are all doing better work that's more comprehensive. So those are my 2 cents. I really appreciate you letting me share, and I'm happy to answer any questions and field any sort of comments.
Great. Thank you so much. Really appreciate you sharing everything that you did, and I think it's been very stimulating for our participants to hear about the great ways that you are moving forward. And I want to encourage folks to continue to share in the text chat about their work, how a focus on risk and protective factors has shaped your violence prevention work, how it might shape a focus in the future, anything else that's coming to mind based on Elizabeth's presentation and anything that might have been stimulated by that. But thank you again, Elizabeth. And with that, we want to move forward to bring in Dr. Linda Dahlberg from CDC as our next guest. And this is another treat to have a second guest on this web conference. Dr. Dahlberg is the Senior Advisor to the Director in the Division of Violence Prevention within the National Center for Injury Prevention and Control. And in Linda's current position, she provides senior executive leadership in the design, conceptualization, and implementation of initiatives aimed at preventing violence and in the application of scientific findings into practice to improve the nation's health. And Dr. Dahlberg has been with the CDC since 1990 and has worked in a number of interrelated issue areas, including the Division of Sexually Transmitted Diseases and HIV/AIDS, working on various issues related to STDs. And in the past 20 years, she has been focused on violence prevention and various forms of violence, including youth violence, child maltreatment, intimate partner violence, sexual violence, and suicidal behavior. And she's also done quite a bit of international consultation work. So, Linda, thank you so much for joining us today and for all that you are going to bring to this conversation. And I wonder if we could get started by having you just tell us a little bit more about your role at CDC, specifically with this most recent document that's come out that we're calling the Strategic Vision.
Sure, and thank you for having me. As Lisa just mentioned, I'm a senior advisor to the director in the Division of Violence Prevention. I've been with CDC 26 years, and with the violence prevention program, actually from its inception. I helped, launch and grow CDC's violence prevention program, starting from a budget of 0 and 5 people. I think sometimes people think that, CDC has a ton of money, but we actually started, like many other people around the world, with nothing, and helped to grow it into what it is today. In terms of the strategic vision process, which I'm excited to tell you a little bit about, I actually led that on behalf of the division.
Great, thank you. So thank you for that background. And Linda, let's start by asking you, how have you seen the Connecting the Dots research? So now we're not talking about the strategic vision document, but the overview of the links among multiple forms of violence. Let's start the conversation there by thinking about the last 2 years and how the research has been used.
Well, first, I think it's just really gratifying to hear at the outset just how many people who are participating in the conversation today have actually are doing some of this, work already. So I think, this particular document and just the work in general in terms of connecting the dots, I think more people are thinking about these connections. I think researchers are starting to give more attention to understanding them and looking for ways to evaluate the impact of various prevention strategies on multiple outcomes. At the state level, I think in many ways that people have found it's a useful way to sort of talk about violence and how it can be prevented. And it's helped states, sort of break out of this siloed approach and see the advantages of creating, common cause with other programs. And, whether that's other program areas such as reproductive health or, sexually transmitted infections, HIV, substance abuse, as well as within and between the different forms of violence. Just as an example, some of our Essentials for Childhood grantees, they focus on child abuse and neglect, and our rape prevention and education grantees, they work alongside one another in states. And so, some of the policy work that our Essentials for Childhood grantees are doing to prevent child abuse and neglect, they're also the types of policies and supports that can impact domestic violence and sexual violence. I'd also think, it's opened up new opportunities for collaboration and to inform some local and state initiatives. Some of you may know this, may not know this, but we are about to begin a new cycle of funding with our core state violence injury prevention grantees across the country. And one of the important features of the new funding is sort of this integration and doing more around a cross-cutting approach. We will also be making new funding awards shortly to grantees who will be addressing shared risk and protective factors for teen dating violence and youth violence, sort of really looking across the social ecology at various strategies that can potentially impact both forms of violence. So we're really excited about that initiative, and it's just an example of the kinds of things that can happen in communities across the country.
Wow, a lot has been happening. It seems like it's been a really powerful and catalyzing resource in a number of different ways. So I want to, we want to hear more from you about where CDC is going and what kinds of opportunities there might be in the future. But so we want to shift into talking about the strategic vision document. So we want to get a sense from participants if folks have read that document. So not the overview of the research, but the publication that, the recent publication, I believe this was a 2016 document. If you could answer the question whether or not you have read the new strategic vision. And the results are coming in, and it looks like about 70% of participants have read the document and around 30 have not. So it's getting, oh, I'm sorry, switch. It sounds like most haven't, so it's great that about 30% have, and I'm glad that we're bringing to other folks' attention that this document has been released, and so now we have the opportunity to hear about its development and how it's been used. But Linda, if you could just share with our group today a little bit more about how the strategic vision document was developed.
Sure. And, for those of you listening, it was just released a few months ago, so that we won't be too offended that you haven't read it just yet. But I'm glad to tell you a little bit more about the way the document was developed, and hopefully you'll explore it. So just to say that this was a division-wide effort, that we didn't really start with any preconceived notions. We sort of let it be an organic process. We did start, with a charge from our division director, Jim Mercy. And he basically came to us and said, how can we maximize the impact of our prevention efforts? That, we know from decades of research that's summarized in the Connecting the Dots document and elsewhere, that the different forms of violence, they're strongly interconnected. They share these common risk and protective factors. They share common consequences. How can we take better advantage of that knowledge? And so we worked with staff to develop ideas, to draft and refine the vision for review. And from that came our strategic focus areas, one being on the developmental periods of childhood and adolescence, where we believe we can have some of the greatest and longest lasting impact. A second is on the populations and communities at highest risk for experiencing or perpetrating violence. Those of you already probably know these are the populations that often experience multiple forms of violence. The risk and protective factors that are shared across the multiple forms of violence. And by facilitating the identification, implementation, and scale-up of approaches that have cross-cutting impact. And that would be from the more policy-oriented approaches addressing inequalities of all kinds, social and cultural norms, and community-level risks, where we believe that we have the potential for some really broad public health impacts, to approaches for more specific populations. And then making all this happen through collaboration, partnerships, using effective communication and dissemination strategies, and then strengthening our research and surveillance. So once we had this sort of draft of these ideas developed and refined, we then held a one-day partner vetting in Washington, D.C., where we solicited, feedback and ideas from our core policy partners. And once we received their feedback, we finalized it. We just, like I said, released it a few months ago, and we're looking forward to carrying this work forward, and I'll say a little bit more about that in a bit.
Sure. So a lot of thought and effort went into the development of this vision, and so it's been released. How do you hope this document will be used? What purpose do you think this document will serve?
So the document itself, we basically describe it as a 5-year vision, but we don't expect to complete everything in 5 years, but rather that we intend to move in this direction in a little bit more deliberate way. And we like to say attending to the dots, which are our core priority areas of, partner violence, sexual violence, youth violence, child abuse and neglect, elder abuse, suicidal behavior, and the lines between them. So this is really going to be our way of communicating what our priorities will be. We will also use it to shape new funding. For example, when planning our programmatic work, practice work, research, surveillance projects, and other initiatives. We engage in a budget planning process. We started about this time every year, and the vision document really becomes one of our anchor reference points for guiding that funding. And also just to guide collaborative work with our partners and communication with Congress. We frequently communicate with Congress and others. And just one thing I just want to mention, it's not a strategic plan, but it is a vision. And so specific activities and operationalization will happen over time. That kind of happens through the planning, the partnership work, the funding activities. And just to give you a few examples, over the last decade or so, we have developed a number of strategic visions that correspond to the different types of violence that we address. So this slide that you're looking at right now, it shows some of the themes of these visions. One being the promotion of nonviolent and respectful relationships. This has been an important theme in our intimate partner violence work. Connectedness, which has been a central theme in our suicide prevention work. Safe, stable, nurturing relationships and environments, which has been central to our child maltreatment work. And safer communities, which help to jumpstart, some of our community-level work initially in the area of youth violence, but later extending to other types of violence that we address. So these all began as vision documents. And if you move to the next slide, just to give you an example of a few, how it's translated into some activities, the original Safe, Stable, Nurturing Relationship strategic vision, for instance, it became the foundation for our Essentials for Childhood framework. I know there were a few of you at the outset that say you are doing some work in the area of child maltreatment. That vision fed this framework, and it has basically been the theme for all of our subsequent child maltreatment activities. Our Dating Matters initiative is an example of an activity that supported our strategic vision of promoting nonviolent and respectful relationships. And some of you may remember, maybe not, several years ago we also did our Choose Respect campaign, and that was another example of using this respectful and nonviolent relationship vision translated into a campaign. And just to say that one of the things that we've tried to do in this new vision document is retain these other core features of connectedness, of respectful and nonviolent relationships, of safer communities, of safe, stable, and nurturing relationships for all children in the new vision document.
I really appreciate hearing just kind of a real sense of the years of great visioning work and implementation work and evaluation work that's been happening at CDC, and that really this is really evolving work that we're all engaged in creating together. And so it's inspiring to see how we go from vision to implementation and that work is continuing, and our work continues to evolve in really positive ways. So I think there's been some great text chatting. I want to circle back to that, and I also want to go ahead and encourage folks to ask any questions or comments they have for Dr. Dahlberg about the strategic vision document or the research overview document. And while folks are adding any additional comments or questions, I'm going to ask Mego if you can just summarize a little bit of what you've been seeing in the text chat and see if there are any comments or questions we might want to pose to Linda at this time.
Sure. There's been some good conversation going on the text chat about the drawbacks of focusing only at the individual level. Some people made the comment that a lot of risk assessments these days are only focusing at the individual level and not on root causes or structural drivers. So that's been interesting to follow in the text chat. As people are putting their questions in, one question that came up earlier is how do you see and describe the difference between risk and protective factors and root causes?
Those are some great comments and questions. I wonder, Linda, if you wouldn't mind commenting on both of them.
Sure.
Starting with the difference between risk factors and root causes, and then also the comment about the importance of focusing on those broader, larger community factors and structural factors that shape them.
So one of the things about in the strategic vision, if you take a moment to look at it, we do try to make, we're very deliberate in terms of mentioning some of those root causes. And, we talk about racism and structural inequalities and other root causes that sort of get embedded into institutional policies and sort of that day-to-day reality, how those things, that kind of food insecurity and housing insecurity and growing up with those types of chronic stresses brought about by a lot of these root causes are things that then, impact, violence, perpetration, the way people, respond to their community. So it's actually, when we talk about risk and protective factors, we are not, we make a very explicit point of not focusing only on individual, only focusing on relationship, but really looking at those community level risk factors and then those societal risk factors and drivers. And this is where I think one of the things you will start to see in terms of some of the work going forward is more attention to how we can address some of those root causes and not write them off as like, those are just root causes. We can't necessarily do anything about it. The answer is we can do some things about that, and there's evidence, sort of starting to, build that of different types of supports and policies that address economic and other factors. So you'll see some of that in the vision, and we certainly want to do more of that work going forward.
It's great to hear. And just to make sure, because I think this question about kind of defining has come up, is there a way that, how would you define root causes versus community and societal level risk factors?
Well, I think language is always something. So like when we just think basically that a risk factor, what, is a factor that increases the risk for, experiencing or perpetrating violence. A protective factor is something that, buffers that risk. And certainly risk factors can emerge at different levels. We do see some of those root causes as risk factors. I don't know if that makes sense.
Yeah.
Yeah. Well, I guess the other thing is, like, I should say I'm a sociologist by training, so I automatically sort of think in terms of those along those lines. And I'm also even like a structural sociologist, so really paying attention to some of those bigger embedded factors and how you break them down.
Yeah, I just personally, I think that's some of the most interesting and important conversations happening in public health, is really trying to understand how these larger forces shape our communities and play out, and how can we as public health be engaged in trying to influence those factors.
Or maybe we can have a webinar on that in the future.
Sounds fabulous. Thanks so much for that inspiration. And on that note, we did want to ask you about, this is great work that you've been doing. You've been engaged for decades, and we really appreciate your leadership and CDC's leadership. And, I know that, there's a lot that happens within CDC to move the nation's work forward. And, with acknowledging the importance of a document like this, just would love to hear from you personally about what excites you most about the strategic vision.
Well, one of the things, I think there is real opportunity to pull together as a prevention community and have a greater impact. So this allows us to think about that broader impact in ways that people don't always consider. And another thing that I think really excites me is it allows for ways to sort of foster collaboration and exchange, to share ideas within and across networks, take the best from everyone, to segment when it makes sense, and to expand the message when it makes sense. I see this really as a way to sort of foster learning and exchange, and to also think of ourselves at CDC as a learning community. I think there's also potential for more resources. Policymakers will be able to see how their resources can potentially make a dent in a lot of things. So this is a way for us at CDC to also champion work and educate policymakers and other decision makers in this regard.
Great. Thank you so much, Linda. It does seem like there's a lot of potential for work that builds on the strategic vision, and I'm sure that it's going to be helpful for folks across the country who are doing work on the ground, to integrate this kind of vision into their own work. So I want to ask you another question and also see if folks can chime in using the text chat. How do you see that local and state sexual and domestic violence prevention practitioners can use the strategic vision to advance their work? In what ways do you think that you can use this as a resource to advance your work? And I know that there are folks who are working on other forms of violence as well, so and other health issues. So how do you think you can use the strategic vision to advance your work, whether that's at the state level or at the local level? We'd really love to hear from you. And Linda, I'm going to ask you the same question. How do you think that practitioners can use this document?
Well, I think the on-the-ground perspective is really important. It's a way of letting CDC know what is going to be most helpful to practitioners to do this work. There are a lot of complexities to doing this work, so that on-the-ground perspective helps us to identify barriers and how to prepare for them and address them. I think it's also a way of making sure that CDC's products and tools are relevant and helpful. I think there is much that we can learn from the field. So using those processes that involve that regular science to practice and practice to science communication, I mean, that is something that really helps to ensure that products are relevant and useful.
maybe we can go back.
There we go.
Yeah.
And just a few other things that for folks out there, like I said before, if you haven't had a chance to look at this vision, take a look at it and take a look at those strategic focus areas, and see where you can use that information to sort of guide your work. Take a look at the data and the data needs, and see where you can potentially advocate for change at the local and state levels to fill those gaps. And we would love it if everyone, really can, this can really help to build a community of practice to make all of this happen.
Great. And I just really appreciate your, your sense of partnership with folks who are, implementing work on the ground, and that sense that you want to hear, what is useful, what is needed, what kind of barriers people are encountering, and how CDC can help to address those. So if folks want to have, if anything's coming to mind, this might be a great opportunity to go ahead and share with Linda. While we are thinking about that, I wanted to go back to Mego and Ashley to see, again, kind of what are some of the themes and questions that have been coming up in the text chat.
So there haven't been too many responses to this recent question about how local and state practitioners can use the strategic vision, although earlier someone from Tucson did share that they're taking a greater focus on risk and protective factors and building this approach into the update of their own strategic plan for violence prevention in both Tucson and Pima County. One question that's come up is from Alexis saying, where do you see state violence intersecting with the forms of violence that are considered in this strategy?
That's great, and I think that there, as a question that I have as well, is that there are, there's such rich conversation happening about different forms of violence, including a term that at Prevention Institute we're really starting to integrate called, structural violence, and that's really the ways in which inequities are historically and present day built into our communities and play out as experiences of violence, of the experience of being excluded or from full participation and access to basic resources for health and wellness. And so I guess we can pose that question. Perhaps we can bring back both of our guests if they're available. I'm not sure if Elizabeth is still available, but Linda, if you could comment on, this question about other forms of violence and how you or CDC sees the strategic vision or the research addressing those other forms of violence.
Well, I guess first of all, I would agree with everything that you just said and the way that you all are starting to think about this. One of the things that wasn't clear from the question, if it's referring to sort of state-sponsored violence or some of the violence that we're seeing involving police and law enforcement, or something else, other forms of like terrorism. So I wasn't sure what Alexis was referring to specifically. Maybe she could add a little more clarification.
Sure, Alexis, if you can talk more about what you structural violence encompassing other forms of violence. Okay. Oh, yeah. Well, let's see. Alexis says that she was not specifically talking about police violence, but state violence definitely includes structural violence. encompassing other forms of violence. So maybe you can talk whatever comes to mind with that, and also generally this question of how do we continue to expand our understanding of different forms of violence and bring the research into that understanding, and also have our understanding influence policy and practice.
So in terms of a vision document, it focuses, as I mentioned, on those sort of 4 strategic areas: childhood and adolescence, the populations and communities at highest risk, those full range of shared risk and protective factors, and then scaling up, implementing, identifying approaches that can impact all of those risk factors. So it doesn't, it calls out those focus areas without specifically calling out specific types of violence, because that's the whole idea, is to sort of look at those things that impact multiple forms of violence, structural violence potentially being one of those. So it's embedded, but it's not explicit in perhaps the way you might be thinking at the moment. And that might be something like also like on the data. I mean, there's other places like in terms of data and really getting our handle to understand what's happening there and what we can do about it.
Well, we welcome additional chatting about both the question that Alexis posed and Linda's comments about that. I think it's a really rich area for discussion, and perhaps another web conference as well. A lot to discuss there. And I also, wanted to come back to this one question Coy Adams posed, and I think, we're just in such an interesting time, an exciting time in public health, shifting from just looking at individual risk to looking at broader community and structural factors, looking at the intersection of issues. And the question here I think is really interesting. Would some of the root causes potentially count as public health issues then, and not just simply individual risk factors? And so I wonder if you could comment on that, Linda. It seems like we're in this exciting moment of really expanding what public health practice is, and in your mind, I think this is just a really interesting phrasing of, does working on root causes or these broader structural factors, in your mind, does that count as public health?
I absolutely think it does. I mean, if you think of public health and what sort of separates public health and public health approaches, say, from others, it is population based, that you are trying to achieve the maximum benefits for the greatest number of people. And so, and the more you work and think at those types of factors that really drive things, ultimately down to individuals, to families, to schools, to the communities, to what's available or not available. I mean, that you have to consider all those things. So I absolutely think that it is something that's really very important to address. It shouldn't be off the table. It shouldn't be left for someone else, because if it's for someone else, who else? If not public health, who else?
Wow.
This is Elizabeth Abla. I wanted to add to that. I think that is absolutely correct. I think this is public health, quite frankly, but I don't think it's limited to public health. And I think I alluded to that in my talk by having multiple fields in coalitions to be able to speak to these topics and to be able to address them, where one type of violence might not be of interest or a core mission of one organization, whereas another might. So we find common ground here, and it is definitely a public health issue. We're able to look at prevention in a really interesting way, but it is a total mind shift in thinking over into a different paradigm where we might even have to think about how funding changes to be able to fund something as comprehensive as changing root causes and root protective and risk factors. It really does make us have to think a little bit differently about how we proceed even with our funding.
I would agree.
Yeah, thank you for that. And so far it's interesting, no one has really commented around barriers and challenges and resources that might be helpful, but this conversation is definitely, leading me to think about both the very exciting times that we're in and the potential for collective work moving forward, as well as, some good challenges that are going to emerge in some of that shift, but all really great work. And I think, Ashley, you had one other question that you wanted to bring up, and then in our last few minutes, we do want to end this conversation with even looking forward further into the future, so we'll leave a couple minutes for that.
Great. Thanks, Lisa. Well, this question came up earlier, and I want to pose it to our guests and also to our audience. But I believe Paula was wondering if anyone knows of any research that has been done translating community-level risk and protective factors to a college campus community. So if anyone knows of anything, it would be great to see those resources. But Linda or Elizabeth, do you know of any research that has been done looking at college campus communities?
This is Elizabeth. I am aware of some research, and I would be happy to share that. It is not extensive by any means, and there's quite a bit of work that needs to be done in that area. So I'm happy to share what I am aware of, though.
Yeah, I would agree. I'm not aware of a whole lot going on in that regard.
Okay, great. Thank you, Ashley, and thanks, participants, for some really great questions and comments. And we want to leave with one last one, and perhaps we can ask it to our two guests and then ask our participants to text chat. So it's August 2016 right now. Take a moment to imagine we're in August 2018, and we're doing another Prevent Connect web conference. It is not me hosting, it is someone else. What would the title of that follow-up conference be? What would be the exciting, rich conversation that we would want to have 2 years from now? So we'd love to hear both from, let's start with Linda, and then we can hear from Elizabeth.
Sort of thinking on with a little idealism, I'd love it if it was like a vision realized. And that not only that, seeing, rates of violence in all its forms drop to their lowest levels in decades, but also safe, thriving, healthy communities that, or, share, stories and lessons from the field, what we've learned, what we've accomplished as a result.
Yeah, this is Elizabeth. I couldn't agree more. I look forward to that webinar. And quite frankly, yeah, I mean, I'm thinking along the same lines. I'd like to see best practices. So what's been implemented, what hasn't worked, and what has. I think this literature is very nascent, and to be able to test it out in the field and to see why it worked in one community and it didn't in another, I think that's going to be really exciting and, quite frankly, our future.
Thank you so much. And Anne says, exciting violence prevention efforts that have really made a substantial difference. So I think that's, very hopeful that we are all looking to make a significant impact impact in the next few years and to really be in conversation and in practice and in research together to figure out how to do that. So with that, I want to say thank you so very much to our guests today, Elizabeth and Linda. Thank you so much for your time and for your contributions. And thank you to all the participants who shared their thoughts. I thought it was a really rich conversation. Thank you to the team who put this web conference on today and all of the work that goes into making this kind of shared learning possible. And until the next time that we gather again on another Prevent Connect web conference, I wish everyone well. Please take good care and good luck with all of your work, and we look forward to connecting again. And with that, this concludes today's web conference. Thank you all so much. Take good care.
Thank you, everyone. We will be sending out a survey. You'll receive that in about 15 minutes. And there will be email coming to you in the next couple of days with a link to the recording of today's session. So thank you, Lisa. Thank you, Mego. Thank you, Casey. And thank you to our guests. We will see you next time. Have a good day.